Antipsychotics are mostly preferred during very worst conditions. They are also known as neuroleptics, a class of psychotropic medication which is primarily used to manage psychosis, including conditions such as delusions, hallucinations, paranoia, or disordered thought. They can affect each individual differently, and their effect on pregnant women is particularly unknown. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and I am going to discuss about the effects of these antipsychotic drugs on pregnant women and their adverse effects on gestational diabetes. CNS Drugs Journal brought out a new study that aimed to assess whether the antipsychotic use during the pregnancy period is associated with gestational diabetes occurrence, and found that drugs like olanzapine, clozapine and quetiapine used during pregnancy were associated with increased risk for gestational diabetes and the infant being large for gestational age. A Swedish National Register-based cohort study included over 1 lakh singleton births. Antipsychotics were divided into 728 first-generation antipsychotics, 1710 in high-risk metabolic second-generation antipsychotics, including olanzapine, clozapine and quetiapine, and 541 in other second-generation antipsychotics. The risk for gestational diabetes, the fetal growth disturbances, preeclampsia, caesarean section, and preterm labor were all assessed. The women treated during the pregnancy period were compared to women not treated during pregnancy and to women who used antipsychotics before or after during their pregnancy period. The risk ratio for gestational diabetes for women treated with high-risk metabolic second-generation antipsychotics during pregnancy was 2.2 compared to untreated pregnant women and 1.8 compared to women treated before or after their pregnancy. Exposed infants had an increased risk of being large for gestational age, while other antipsychotics were not associated with metabolic risks. Hence, the researchers concluded that olanzapine, clozapine and quetiapine used during pregnancy were associated with an increased risk for gestational diabetes and the infant being large for gestational age. The enhanced metabolic monitoring should definitely be considered for pregnant women using these drugs. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.